Hello everybody, this is Dr. Bob DiMaria with another episode of Ask Dr. Bob. We have questions from all over the world, and we had the very first one. Someone said, "Good day, sir," so I know they're probably not from the United States, and we appreciate all the questions. This individual had stomach pain, nausea, chest pain, some yellow urine for 3 months, was really concerned about the fact of possibly having hepatitis. Here's what my suggestion for me to you would be: have your primary healthcare provider do and complete some additional testing. First, it'll be a peace of mind. Second, you're going to be able to get to the root cause of what's going on inside of your body. I would love to give you some more answers on specifically what else you may consider to do, but that would be my very first step, to have some testing done to you. Hello, Dr. Bob. What can cause frequent nosebleeds in a 10-year-old child? This is an excellent question. Oftentimes we'll have individuals that have babies that will have fevers when they're teething. It's a body signal to us that they need calcium. Then the next time period, there's oftentimes during a child's formative years, they're going to be going through some calcium need. And at 10 years old, let's just say, because this depends on everybody, they could be going through a growing spurt. And guess what a growing spurt needs? Calcium. So traditionally, we use a product in our practice called CalMagzyme. But what I have found is that calcium helps prevent and stops nosebleeds. And that might not be for everybody, but we have seen that little secret work a lot for so many people. Another body signal for calcium need is cramping in the legs at night, chronic cold sores, even poison ivy. That's right, poison ivy, from my experience, is a body signal you might need calcium. Dr. Bob, you mentioned that varicose veins in a big tummy are signals of gallbladder issue. I have varicose veins in my left leg and a big tummy. Well, it's not only your liver or your gallbladder, it's a combination of the two. You see, blood flows through your liver on the way to your heart. Your liver makes bile that's stored in the gallbladder. So I want to clarify that for you. It's not necessarily a gallbladder that's stopping the blood flow. It usually is the liver stopping the blood flow, so you may have varicose veins, spider veins, and hemorrhoids. We use a product in our office called Collinsonia root. You also need to support liver health. We use a product that's Livitrit, which is a proprietary blend of herbs. You may even consider the castor oil pack, and you may even consider having some blood chemistries done by our office. You can do this anywhere in the world, by the way, and we would check for your bilirubin, which is a test that we can determine some liver gallbladder stasis. That was a good question, by the way. Dr. Bob, what's a good vitamin for eye floaters? Well, eye floaters can be caused for a lot of different reasons. Number one, from my experience, is usually lack of vitamin A. So your liver is a storehouse of vitamins A, D, E, and K. And if you're in a very toxic environment, your liver has to work hard, you could use all your A up. And so your liver will literally take the IA for itself. And that's when people start to notice floaters. So we use a product in our practice called AE Emulsion. I actually put 2 drops in my tongue every day. It's also excellent for skin health. You want to eat a medium carrot every day. Last questions. What's your recommendation for adrenal support? Well, adrenal fatigue is commonly caused by 2 reasons: sugar and stress. And I talk about this in Dr. Bob's Drugless Guide to Balancing Female Hormones, and Dr. Bob's Men's Health the Basics, and Dr. Bob's Guide to Prevent Surgery. All are excellent books talking about adrenal function. So we actually use the professional blend, the professional strength adrenal support from Gaia Herbs. I also know that people, you had the question continue on, that you have low potassium and low magnesium. So great food sources of magnesium are anything green. Chlorophyll is magnesium. Excellent source of potassium would be avocados, and you may even consider Celtic sea salt. So you could use adrenal support from Gaia Herbs. You could also maybe even think about having a hair analysis done. The hair analysis will oftentimes reveal low sodium and low potassium. That was a lot of good information. Now, you might be sitting anywhere in the world right now thinking, I need to have some new health concepts, some new health insights. Do you know, every week we have someone that comes to visit us from either continental United States, Canada, or somewhere even from Africa, South America, and Asia. So we are here. Just come to Cleveland, Ohio, and we'll make a difference for you. I'm Dr. Bob DeMaria.